Hey guys, Dr. Ray Marquez here, your local chiropractor down at Back Pain Relief Center in Murrells Inlet. I'm here with Chris Ionicone. Chris is a good friend. He is a training partner with me in Judo. He's also a partner of one of our senseis in Myrtle Beach BJJ in Judo. And he's all beat up. So we were rolling, was it yesterday you heard it? Yesterday, and he was getting scared of me and I don't know what he was doing, but he fell on his shoulder and he's injured it. And he's actually in some pain in all seriousness, and we're having some limited range of motion, and he's feeling some pain out in the shoulder. I've known Chris for a long time. I know his body. I know how things work. So what we're going to do, this is going to be a series of live videos. So we're going to show a little muscle work that we may cut out. We'll come back and we're going to show a few different things that we're going to do on him. But he's telling me that he's having pain here and it all feels tight. And if you feel it, man, there's a lot of tension in there. So all I'm simply going to do is just try to loosen this whole joint up to give him some better range of motion. Something that may be a little tender for him because we're putting pressure on some trigger points, but the end result is what we're looking for. All right, Chris, so it may be short motions. I'm gonna put some pressure on the shoulder capsule here, and I just want you to come up and down for me 5 times. 1, 2, 3, 4, 5. Good, you okay with that? We're going to go to the front, and I'm going to want you to touch your knee and then come up as best you can. It's going to be a little more painful because I'm pushing on you. Okay, 1, 2, 3, 4, 5. Good. Okay, touch your belly. If you can, touch your back as best you can. 1, 2, 3, 4, 5. Okay. Now we're going to go here to your back pocket as best you can, okay? 5 times. 1, back as best you can. 2, 3, 4, 5. We didn't have any swelling, any bruising, anything like that in there? I'm going to be here, down, out, back, up. Okay, 5 times. 1, 2, 3, 4. It's just a little more loose, isn't it?
Yeah. That's a lot.
What happens? You fall, and you know, Chris is the most beat up person I know. Number 1. Number 2, he's the best, the most in shape person I know. By far, much better shape than I am. And I think doing all of that keeps everything tight. And when he gets an injury, you know, I want to get this thing moving the best way we can. Okay, we're going to be here, down, and then touch your knee. Okay? This one. 1, 2, 3, 4, 5. Good. Okay. We're going to move on to the neck area because even though it's a shoulder problem, the traps tie right in. He's complaining of some tightness up through his neck. We're going to try to loosen that up. Okay, so look all the way down for me. And a big pull. It can come back up. 1, again. 2, 3, 4. A little tender in there, Chris? Yes. 5. Okay. Turn your head to the left, and then go up and down 5 times. So what I was getting at with the beat up part, 2, 3, 4. He's got a lot of degeneration in his lower cervicals and his upper thoracics, a bunch of herniations in there. A manual manipulation by far is not even remotely appropriate for him. If we would go to justice, he'd fly off the table, be in a bunch of pain. But all this muscle work is what's going to keep him going. Turn your head this way, up and down 5 times. 1, 2, 3, 4, 5. Good. Next, I'm going to use this big old massager here just to loosen it a little more. This should be the easiest part of the treatment. We're going to cut up here for a second. I'm going to get my laser all set up. We're going to use some cold laser on the shoulder to try to get it to heal a little quicker. So tune back in here in just a second.